How do you use minimal pairs for R sound therapy? Imagine helping a child turn their speech from unclear to confident. Using minimal pairs is a simple yet effective way to do this. These pairs are to words that differ by only one sound, like red and weedy. When a child substitutes the R sound with a W sound, these pairs highlight the difference. This method helps children hear and understand what makes the R sound unique. It is especially helpful for children with speech sound challenges or articulation issues. The first step is auditory discrimination. The speech-language pathologist, or SLP, plays a key role here. They help the child listen carefully to the two words and notice how they are different. For example, the child might listen to red and wed and then point to pictures of a red hat and a wedge. This step builds awareness that the two sounds change the meaning of the words. Next, the child practices saying each word separately. The SLP encourages the child to repeat red and then weedy. During this, the SLP might give cues or gentle reminders to focus on the R sound. Repeating the words helps the child practice producing the correct R sound in isolation. After that, the child practices saying both words together, like red, weedy. This reinforces the contrast between the correct R and the substitution sound. It helps the child internalize the difference and start to produce the R sound more accurately. Then comes role reversal. The child becomes the teacher by saying one of the words while the SLP points to the picture. This activity encourages the child to listen actively and monitor their own speech. It makes the learning process more engaging and helps solidify the correct R sound. Finally, the child practices using the words in sentences. For example, I see a red hat and I see a weedy. This step helps carry over the correct R sound into everyday speech, making it more natural. Supporting techniques include teaching the child proper tongue placement. The R sound requires the tongue tip to be raised, sides touching the upper molars, and the tongue pulled back. Visual aids like mirrors or fun props can help children see and feel the right position. Repeating exercises and gradually increasing difficulty from words to phrases and spontaneous speech also boost progress. Minimal pairs are especially effective when a child's errors follow a pattern, such as replacing R with W. Consistently contrasting the correct sound with the substitution helps the child learn to hear and produce the R sound correctly. With regular practice, children improve their articulation and overall communication skills, making their speech clearer and more confident.